Hi, I'm Lauren Thomas. In this lecture video, we'll discuss the health belief model. The health belief model's essence is that personal beliefs influence health behavior. So let's talk about the origins of the health belief model. In the 1950s, the U.S. Public Health Service, which was our public health system at the time, began to promote tuberculosis screening programs to detect TB early before it was too late. This was a widespread national campaign that unfortunately, public health professionals were super excited about it, but the public turnout for these screening programs was pretty poor, particularly the screening programs around TB, tuberculosis. And, public health researchers were kind of in a tizzy about this. They wanted to understand, we're making this screening program free. Why aren't people showing up to take advantage of finding out if they have tuberculosis? And before we answer that question about why wasn't the public clamoring to get their low cost or free TB screening, I want you to watch this video that explains the process of what it takes to be screened for TB. As you can see from the video, this screening process was pretty structured, pretty rigid, pretty public, pretty vulnerable. So there were some barriers in people's way, not only physical barriers, but psychological barriers and situational barriers. So the research that the public health professionals showed was that there were three factors that determined whether or not an individual was willing to get screened for tuberculosis. This is the health behavior that they were wanting to change, is to have more people get screened through these screening practices. So there were three factors. One was, were they psychologically ready? Did they believe that they actually had TB symptoms? If they didn't feel they had symptoms, they might say, I'm good, I'm fine. They also had to believe that they were at risk of TB. They had to assume, some people might have assumed, I think I'm fine. I haven't been around anybody who might possibly have TB, so why would I think that I have it, right? They may not even think of themselves as susceptible. And then they also have to have the strong belief that they would benefit from getting screened. So all of those things had to happen psychologically. They also have to have their situational influences. They have to have the belief that they had the symptoms, right? But then it comes to sort of the interpersonal elements. What are other people that I value their opinions? What are other people's opinions on their decision to get screened for TB? If the parent or a friend has not been screened for TB and didn't plan on it, then it's probably more likely that that individual would not want to get screened for TB as well. There's a normative element there. And then physical barriers, environmental conditions. How convenient was the screening actually? Was it accessible to them? Did the workplace even require, where they worked, did it require screenings? And none of this at this point here, at the time of this recording, we all understand what this means. There are barriers in people's way of getting screened for any sort of health condition. We just have experienced a seismic event in the COVID-19 pandemic, and we understand that there's a need for a readiness. There's a need for a strong belief that the screening tool is actually going to do me good and less harm. So that's the concept. That's the essence of the health belief model, that personal beliefs, personal perceptions about health influence behavior. Let's dive a little deeper into the health belief model and unpack the theoretical constructs that make up this theory. There's perceived seriousness, perceived susceptibility, perceived benefits of the behavior change. There are perceived barriers to the changing of the behavior. There are modifying variables, cues to action, and self-efficacy. Let's talk about all those now. Perceived serious means how severe do you think this disease will actually be for you? It's the perception or the belief as to the severity of a disease or health condition. So sometimes this is based on knowledge. This is based on just the facts, but often it's mixed in with some additional factors like your culture, past experiences. Have you handled something like this before and you felt like you came out of it just fine? The social norms, and other factors. So the seriousness, your perception of how serious this disease actually is, could also be impacted by your existing lifestyle. Meaning, if you are someone who thinks of yourself as very capable of recovering well, then you're likely not going to think this particular health condition is that serious. However, if you've experienced a health challenge before in your life, and it's been significantly debilitating to you, you might actually think of this as something that you need to really become more aware of. Perceived susceptibility means, how vulnerable do you think you are? So this is the perception of your own personal risk for developing or contracting a particular disease or condition based on your health behavior or unhealthy behaviors. Perception of risk doesn't always explain behavior because we know that in the time of this recording, we all know that tanning beds aren't good for people, and yet tanning beds still exist. We all know that cigarettes are not good for you, and yet people still smoke. We all know, this is going to really hurt, we all know that being on social media for long, extended amounts of time has really done some damage to people's anxiety levels, depression, loneliness, just from all this excessive usage. We know this, and yet there's a level of addiction now. So we are incredibly susceptible, incredibly vulnerable to developing or contracting particular diseases or conditions based on our health or unhealthy behaviors. The health belief model has a fun little formula here that includes these two theoretical constructs: perceived seriousness and perceptive susceptibility equals out someone's perceived threat of disease. So from a health educator's perspective, if we really want someone to make a change very quickly, we need to up that perceived threat level, because if someone doesn't truly believe that this is a threat to their livelihood, to their well-being, they're not going to change. On top of that, there's also perceived barriers. What are all of the barriers in an individual's way to make that behavior change happen? Even if they wanted to, that's not enough. Even if they do see it as a threat, that's not enough. If these barriers are in people's way, that's just another obstacle for them to have to climb over, and motivation can start to wane there. So personal opinions, personal perceptions of the obstacles in their way really matter. So as health educators, it's our job to find ways to remove both psychological barriers in folks' way as well as environmental barriers that are in people's way. So perceived benefits of behavior change is where health educators need to shine. This is where a lot of time needs to be spent. A lot of emphasis needs to be pushed. When people really value and see the usefulness of making this behavior change happen, when they see that it's going to increase their well-being, their quality of life, their longevity, if they see this is going to enhance their relationships, then they see there's a benefit here. If they see that this behavior change is going to help reduce their risk of developing a particular disease or eliminating a disease or reducing the lower, poorer quality of life that they're having, if they see benefits in making this behavior change, then that's a good thing. That's where you want to really just stay in that space for a while. Who's the expert at knowing their own benefits? It's the patient, it's the client, it's the community, it's that individual that you're serving, not you. Formula number 2 within the health belief model is that when you think about all of the perceived benefits and you think about all the perceived barriers, benefits need to outweigh, they have to outweigh the perceived barriers. Change is more likely when benefits outweigh the barriers. This is all perception, but change has to happen. So the only way that we can ensure that change is going to happen is if we really emphasize with that individual and remind them about who they want to become. They need to be reminded as a community, what are your community values? What kind of community do you want to become? What really holds true? What are your values as a community, as a family, as an individual? And really focus on those benefits, that this behavior change is going to help support these benefits, this type of life, this type of community to really shine and come through. That's how change can happen for the long haul. There are other factors that impact decision-making when it comes to people's health, and that includes developing skill sets, specific skills. So that sometimes skills need to be developed in order to apply the knowledge that they know. They may know that time management is important for them, but how do I do that actually? So these are skill sets that might be in someone's way. So developing these skills are an important thing that can be changed in order for ultimately this behavior to take shape and take formation. A person's culture, where they're from, really matters, because their own perception of who they are as an individual within their community, what is expected, what is accepted, what is highly valued, it matters to them. If it matters to them, it matters to you as the health educator. And then also their own past experiences. Their past experiences shape their perception about what is true and what is possible. Within the health belief model, there is a theoretical construct that you understand very well: cues to action. You get these reminder texts, you see the billboard messages, you see, advertisements, commercials about the latest drugs or the latest technology that exists. These are cues to action. These are all things that are trying to compel you to move, to do something. Usually in the corporate capitalistic world, it's about buying something, buying a product. In public health, we're here to help remind you about moving towards this particular behavior that we are really hoping that you would make, and you take ownership of that. Sometimes it means we need to kind of kick you in the butt a little bit. That comes with reminder calls, again, billboard messages. It might mean hearing a testimony from someone who's also had experience with that particular disease to share with you how susceptible they were, how severe this particular disease was, their own journey. It also might mean something like a text from a friend to join them on a walk, and you go, oh yeah, I do need to exercise more. And that text from a friend was your cue to action. So cues to action are events, people, things that move people towards changing their behavior, hopefully for the better. Some cues to action are more effective than others. I'm sure you've recognized this, that often all this junk mail, email that you get, you don't answer every email, you don't respond to everything. It's not always effective. It's not, not all cues to action are as effective as the next. One of the unique aspects of the health belief model is that self-efficacy, which is the personal perception of someone's ability to do something new, is a theoretical construct within the health belief model. So a theory within a model. That's kind of fun. Remember, self-efficacy means people will only do what they think that they can do and will not do what they think they cannot do. I have this picture of the COVID-19 testing, the rapid test, because the first time you used it, I'm sure you recall, this is a behavior that we are now very familiar with, which was you would take it and you're kind of like, what do I do with this thing the first time? But then you understand how to use it, and now it's second nature to you somewhat. So self-efficacy, the ability to do something new, your own perception of your ability to do something, is an incorporated construct within the health belief model. So some key takeaways that I want you to consider when you think about the health belief model is that a lot of healthcare professionals spend a great deal of time convincing patients about what threatens their health. What the health belief model would challenge people to think about is that behavior change is more likely when the benefits outweigh the barriers. So instead of convincing people or attempting to convince people that, oh, you better do this, this is why it's so bad, how about instead emphasize all of the values, the alignment of their own, that individual, that patient's personal goals are, and how this behavior will support their goals of having a vibrant life, of having a beautiful, delightful life, a long life filled with love and support and belonging. People will only do what they think that they can do. So if you continue to share all these threats to them, the doubt in their mind, their own self-efficacy might actually wane. So you're undermining yourself by continuing to harp on all of the barriers and seriousness and susceptibility of this particular disease. Doesn't mean that there isn't a place for it. It just means that that place is pretty reduced, and instead spend more time thinking about all of the benefits of that behavior change. You actually might get a much more sustainable change in that patient's life. So I hope that's been helpful for you to understand the theoretical constructs and the essence of the health belief model.